Bismillahirrahmanirrahim. Our topic today will be about children in society, and by the end of this lecture we should have covered the following objectives: children rights, child abuse including types, risk factors, when to suspect, investigations and management, and then protection of our children. This is Maria Colwell, a British girl who was born on 26 March 1965 and killed by her stepfather in Jan 1973 after kicking her to death. The sad fact in her story that a lot of her school teachers and neighbors witnessed the physical abuse that Maria survived, even though they called her the walking skeleton. The case was widely reported at her time and resulted in a public inquiry. Nearly 50 years after her death, the case of Maria Colwell has remained in a collective memory and has often been referred to when similar cases have come to light, such as the death of Victoria Clemby in 2000, Peter Connery in 2007, and Daniel Pilka in 2012. All of them were victims also of children maltreatment. And why this topic is very important, because there is very high prevalence of children maltreatment all over the world. So according to the National Society for Prevention of Cruelty to Children in England 2013-2014, there were over 11.5 million children under 18 years of age suffering from children maltreatment. Over 62,000 children and young people talk to Childline about abuse, and over 68,000 children in care. So in 1989, UN stated a convention on the rights of the children, giving governments the responsibility to ensure that the children are properly cared for and protected from violence, abuse, and neglect. And this is the summary of the UN Convention on the Rights of the Children in 1989, including 4 main categories: survival rights, developmental rights, protection rights, and participation rights. Survival rights: the child's right to life and the most basic needs, food, shelter, and access to health care. Then developmental rights: to achieve their full potential, education, play, freedom of thought, and religion. And then protection rights: against all forms of the abuse, neglect, and discrimination. And then participation rights: to take an active role in their communities and nations. So let's talk more deeply about children abuse. First, for the risk factors, when to suspect for the child abuse. Multiple risk factors including children factors, parents factors, or family or environmental factors. First, for the children, when the child is failed to meet the parental expectation or aspiration, like disabled child, wrong gender or difficult child, or born after forced or commercial sex. Or parental risk factors as mental health problem, parental intolerance, alcohol or drug abuse, or environmental factors as step parents, social isolation, young parental age, poverty, or poor house. These are the types of the children abuse: physical abuse, which is the most prominent type, emotional abuse, sexual abuse, neglect, and fabricated or induced illness. In addition to these categories, witnessing intimate partner violence is regarded as a form of children maltreatment. Also in the UK, the practice of the FGM is also regarded as a form of child abuse. Physical abuse. This is the first type of the children abuse, and this is the most prominent type of the abuse and the easiest to identify. Physical abuse may involve hitting, shaking, poisoning, burning or scalding, drowning, suffocating, or otherwise causing physical harm to the child. Identification of the child abuse in children with disability may be more difficult. Disability is also a risk factor for the children abuse. This is a case scenario of a child suffering from physical abuse. A 2-month-old boy who was brought to the emergency department with sudden loss of consciousness, and his mother accompanying him appeared to have learning difficulty and could not explain what had happened. His father arrived soon after and said that he had been changing the child's nappy on the floor when suddenly he went all floppy and asleep. The child was unresponsive and had a shallow breathing. His pupils were dilated. He appeared well nourished and was addressed only in a nappy. There was no obvious injuries seen. So this is the investigation done to the child. Medical management was rapidly instituted. He performed a CT scan which showed subdural hemorrhage, chest X-ray. This is the subdural hemorrhage. And chest X-ray that revealed old posterior rib fracture. This is the callus formation for the old posterior rib fracture, and then subsequent ophthalmologic examination revealed bilateral retinal hemorrhage. The child was transferred to the ICU where he unfortunately died. The parents maintained their story despite the competing evidence of inflicted head injury and shaking. The case went to the criminal court and both were sentenced on a number of charges. Many more children suffer permanent injury. Most have been seen previously by the health professionals, unfortunately. Early recognition and response to the children protection concern could prevent severe injury. So, when to suspect for the physical abuse for you as a physician or pediatrician, when to suspect that the child is receiving or suffering from physical abuse. First, the history given by the child if they can communicate. Then there is nobility of the explanation for the injury. 3. Any background like previous child protection concern, multiple attendance to the emergency department. 4. Delay in reporting the injury. 5. Inconsistent history from the caregiver. 6. Inappropriate reaction of the parents or the caregiver who are vague, unconcerned, excessively distressed, or aggressive. This is some examples of the physical abuse of the children. So picture A, show bruising from finger trauma to the baby's head. Picture B, showing scald of the stocking distribution, including the soles from forced immersion in hot water. And picture C, showing a bite mark on the infant leg. Adult bite mark may be seen in abuse, but bites from other children are very common. Also, this is more examples of injuries that are more likely to be inflicted or may be inflicted or accidental trauma or less likely to be inflicted by physical abuse. Second type of the children abuse is the emotional abuse, which is more difficult to identify than the physical abuse. Emotional abuse is the persistent emotional maltreatment of the children, resulting in severe and persistent adverse effects on the child's emotional development. It may involve conveying to children that they are worthless or unloved. It may also involve seeing or hearing the ill treatment of another children or person. It may also involve serious bullying that causes the children to feel frightened or in danger. Some level of emotional abuse is involved in all types of maltreatment of children, although it may occur alone. This damaging form of abuse can be difficult to identify in a single brief healthcare interaction with the child or the caregiver, but may be apparent when the observation period recurs or is longer, like when admitted in in the inpatient department. So, when to suspect for the emotional abuse, there may be clues from the behavior of the child depending on the child's age. For the babies, you can notice a apathetic child or apathetic baby, delayed development, non-demanding baby, described by the mother as spoiled, attention-seeking, in control, not loving her. Then for the toddler, you can notice violent child, apathetic face, fearful behavior, school children, wetting, stalling, relationship difficulties, non-attendance, antisocial behavior. And for the adolescent, self-harm, depression, aggressive behavior. In addition to the emotional abuse by the parent or the caregiver, bullying by other children is increasingly recognized as an important form of emotional abuse. Every school should have a written bullying policy that needs to be implemented when necessary. Third type of children abuse is sexual abuse. Sexual abuse involves forcing or the child or the young person to take part in sexual activities, including prostitution, whether or not the child is aware of what's happening. And when to suspect for the sexual abuse. First, when the child or the young person may tell someone about the abuse, be identified in a photographed material, be pregnant, have a sexually transmitted infection. For the physical symptoms, you can notice vaginal bleeding, itching, discharge, rectal bleeding. Then behavioral symptoms is unexpected awareness of or acting out of sexualized behavior beyond what would be expected for age, soiling, secondary neurosis, self-harm, aggressive or sexualized behavior. Unfortunately for the signs of the sexual abuse, there are few definitive diagnostic signs of the sexual abuse on examination, and nearly all the examination after suspected sexual abuse show no positive finding. Why? Because the genital area heals very quickly in the younger children, so signs may be absent even a few days after significant trauma. Forensic material also decay rapidly. So examination of the children suspected of having been sexually abused requires a doctor with a specific experience and training, facilities for photographing documentation, sexually transmitted infection screening and management, and where indicated forensic testing. Forensic testing of swabs from the child and his or her clothing, bedding may reveal DNA from the body fluid of the insulter. Fourth type of the children abuse is the neglect. And neglect include the persistent failure to meet the child's basic physical or psychological needs, likely to result in the serious impairment of the child's health or development. It may involve a parent or caregiver failing to provide the following: adequate food and clothing, shelter including exclusion from the home, protection from physical or emotional harm or danger, adequate supervision including the use of inadequate caregivers, access to appropriate medical care or treatment. It may also include neglect or unresponsiveness to child's basic emotional needs. When to suspect for the neglect: when the child consistently misses important medical appointments, lacks needed medical or dental care or immunization, seems hungry, is dirty, is wearing inadequate clothing in cold weather, is abusing alcohol or other drugs, said there is no one at home to provide care. Also, when the parent or the other adult caregiver appears to be indifferent to the child, seems apathetic or depressed, behaves in a bizarre manner, is abusing alcohol or drug abuse. Fifth type of the child maltreatment is the fabricated or the induced illness. This is a broad term to describe a group of behaviors by the parent or the caregivers, but usually the mother more than 80%, which cause harm to the children. It fulfills the parents or the carer's own needs. It may consist of verbal fabrication, when the parents fabricate or invent symptoms and signs in the child, telling a false story to the healthcare professionals, leading them to believe the child is ill and requires investigation and treatment. Medical and nursing staff are used as an instrument to harm the child through unnecessary intervention, including medication, hospital stay, test and surgery. In community settings, the false stories may lead to medication, special diet, and restricted lifestyle or special schools. Then induction of illness like suffocation of the child, administration of noxious substance or poison, excessive or unnecessary administration of ordinary substance as excess salt, excess or unnecessary use of medication, the use of medically provided portal of entry such as gastrostomy buttons, central lines. Organic illness may coexist with the fabricated or induced illness in a child, thus making the fabrication more difficult to identify. It may manifest as overprotection, imposing unwarranted restrictions, or giving treatment that's inappropriate or excessive. The condition can be extremely difficult to diagnose, but may be suspected if the child has frequent unexplained illness and multiple hospital admissions with symptoms that only occur in the carer's presence and are not sustained by the clinical finding. Sixth type of the child abuse is the intimate partner violence. Observing violence between adults who are or have been intimate partners or family members is also a form of the child abuse. Threatening behavior, violence, abuse, psychological, physical, sexual, financial, or emotional, are recognized to contribute to poor short-term and long-term outcomes for children and young people. This is the last type of the child abuse, which is the FGM or the female genital mutilation, and this is a big problem, especially in developing countries and in Egypt. This is defined by WHO as all procedures that involve partial or total removal of the external female genitalia or other injury to the female genital organs for non-medical reasons. It's recognized as violation of the human rights of the women and girls between 100 to 140 million women and girls are thought to be living with the consequences of the FGM. In December 2012, the UN General Assembly voted for its elimination throughout the world. So these are the types of the FGM. Picture A showing normal female genitalia, showing an opening for the vagina, an opening for the urethra, and then the folds of the labia minora, and then the labia majora, and the clitoris. So picture B showing type 1 FGM. Type 1 FGM including prepuce removal only, or prepuce removal and partial or total removal of the clitoris. In type 2, this is also include also removal of the clitoris plus part of or all of the labia minora. And then type 3, including also removal of the labia majora, so removal of part or all of the labia minora with the labia majora covering the urethra and the vagina, and leaving only small opening for the urine and the menstrual fluid to go through. So, what investigation should I do for a case of suspected child abuse? In case of physical abuse, fractures in young children may not be detectable clinically and the X-ray are required to identify them. Bruising overlying a fracture is rarely seen on presentation. A full radiographic skeletal survey with oblique views of the ribs should be performed in all children with suspected physical abuse under 30 months of age. Some lesion may be inappropriate or inapparent initially, but if indicated, become evident on repeat X-ray 1 to 2 weeks. Other medical conditions that need to be considered and excluded in suspected child abuse are: in case of bruising, do not forget to exclude coagulation disorders, Mongolian blue spots on the back of the thighs. In case of fracture, do not forget to exclude osteogenesis imperfecta, which is commonly referred to as brittle bone disease, and this is autosomal dominant disorder. With a positive family history. Blue sclera may be a key clinical finding, and there may be generalized osteoporosis and wormian bones in the skull. In case of scalds or cigarette burn, don't forget to exclude bullous impetigo or scalded skin syndrome. When brain injury is suspected in all children, require immediate CT scan, skeletal survey, ophthalmologic examination to exclude retinal hemorrhage, and coagulation screen. For the management of the child abuse, abused children may present to doctors in the hospital or the medical or nursing staff in the community. They may also be brought for the medical opinion by social services or the police. In all cases, the procedures of the local safeguarding children board should be followed. For children who are able to talk, it's good practice to use a chairperson and speak to children without parents being present. The medical consultation should be the same as for any medical condition, with detailed history, full examination, usually most productive when this is conducted in a sensitive and concerned way without being accusing to the parents or the caregivers. Any injuries or medical findings should be carefully noted, measured, recorded, and drawn on a body map and photographed with the consent. The height, weight, and head circumference, when appropriate, should be recorded and plotted on a centile chart. The interaction between the child and the parent should be noted. All notes must be meticulous, dated, timed, and signed on each page. Treatment of specific injuries should be investigated and blood tests and X-rays undertaken. If the abuse is suspected or confirmed, a decision needs to be made as whether the child needs immediate protection from the further harm. If this is the case, this may be achieved by admission to the hospital, which also allows more investigation and multidisciplinary assessment. So most parents are willing to accept medical advice for the hospital admission for observation and investigation. Occasionally this is not possible and legal enforcement is required. If medical treatment is not necessary but is felt to be unsafe for the child to return home, a placement may be found with the foster carers. When dealing with any child suspected of having been abused, the safety of any other sibling or children at home must be concerned. The police and/or social services should be alerted to any concern. In addition to detailed medical assessment, evaluation by social workers and other health professionals is required. A strategy meeting and later a child protection conference may be convened in accordance with the local procedures. Members may include social workers, health visitors, police, general practitioners, pediatrician, teachers, and lawyers. Parents attend all or part of the case conference. Details of the incident leading to conference and family background will be discussed. Good communication and trusting working relationship between the professionals are vital, as it may be extremely difficult to evaluate the likelihood that injuries were inflicted and the possible outcome of the legal procedure. This is for the summary of this lecture. Child abuse is the responsibility of all doctors and must not be avoided or ignored because it raises difficult issues and possible appearance in court. It takes various forms: physical abuse, emotional abuse, sexual abuse, neglect, fabricated or induced illness. The interest of the child should be kept uppermost to ensure protection from harm. In many instances, it's uncertain whether or not the problem is one of the child abuse. Good communication with the parents and the child is vital.